Hi, so welcome. This is our Facebook Live video today. We're going to be talking about the medical detective approach to treating headaches and migraines naturally. And so with naturopathic medicine, there are many different possible causes for headaches and for migraines. And one of the things that we really want to try to figure out is the underlying cause. So that's one of the things that we're going to take a look at. Let me see. So I'm trying to figure out if I can share the screen. I am not seeing it here. Sorry. So I'm just going to talk about this. I may not be able to show you that diagram. But one of the things that I like to talk about is if you just picture an iceberg and you see the top part of the iceberg sticking up above the water. But if you look at a picture of an iceberg, there's actually a huge amount that's usually underneath the surface. So there can be many different possible things that can be going on in terms of what's causing headaches or migraines. And most of the time when you go to your regular conventional doctor, they will often either prescribe you an NSAID like ibuprofen, or they may give you, if it's migraines, they usually will give you pharmaceutical migraine medications like Topamax, or there's many other different pharmaceutical medications that are used to treat migraines. The issue is that they aren't treating the underlying cause. And of course, when you're in acute pain and you have to function, it can be okay to take those medications so that you can be able to function. But the question is, what is causing the headaches? What's causing the migraines? And that can definitely be a problem. And in conventional medicine, that is usually something that's not addressed. So I'm going to talk about some of those different conditions that can be underlying causes, and then I'm just going to share a few cases with you of some patients that I had. So one of the things that I'll look for to start with is I'll ask people about their diet and make sure that they're drinking enough water. For regular headaches, not so much for migraines, but for regular common headaches, dehydration can be a pretty common cause. And so if you're not drinking enough water, then that can be a simple underlying cause of headaches. So number one, making sure that you're drinking enough water. Typically, for most people, unless they have some kind of medical condition where they have limitations on how much water they can drink, I usually will recommend trying to aim for about 64 ounces of water a day. So if you have a 30-ounce hydro flask, then it's about 2 of those a day. Of course, if you do have medical conditions where you have limitations on how much water you can drink, like congestive heart failure or renal failure, or other types of things, definitely talk with your doctor about how much water you can safely drink. Other types of causes can be food allergies or sensitivities. So there are the classic food allergies, which can be tested by blood testing or skin scratch testing. Those can be tested by a primary care doctor or an allergist, and I can order those tests as well. And so sometimes if people have food allergies, those can cause headaches. And I have seen people who have no symptoms of the typical types of allergy symptoms where you have eczema or rash or sinus congestion or itchy red watery eyes or nose or sneezing or things like that. So some people do have mild allergies with none of those classic types of symptoms. And then those allergies, food allergies or environmental allergies, can contribute to chronic congestion, which can lead to sinus headaches or congestion and cause headaches. However, I do see some people that don't have the classic types of sinus headaches. Sinus headaches would be pressure that's here or up here, or sometimes it can feel like it's behind your eyes. However, some people don't have any sinus congestion, no sinus pressure, no sinus pain, but they may still have a very mild food allergy that's contributing to just a generalized type of headache. So that's one of the other things. There also is a different type of antibody, which is called a food sensitivity. And so I'll often test for that because that can basically increase inflammation in the body overall, and that can sometimes be a contributing cause of headaches as well. Other types of things that I like to look for, hormonal issues. So hormones can definitely play a role in both regular headaches as well as migraines. So particularly for women, premenstrual headaches or migraines can occur, and those can be due to an imbalance of hormones. One of the most common types of things that we see is that the estrogen and progesterone are imbalanced. So very commonly when women have a lot of PMS or menstrual migraines or headaches or a lot of what's called dysmenorrhea or menstrual cramps or other types of menstrual symptoms, then that is typically due to too much estrogen and not enough progesterone. And estrogen and progesterone balance each other out. And so if you have estrogen that's too high, it will usually push the progesterone lower and vice versa. So if the progesterone is too low, then that can actually counterbalance the estrogen and you can have this imbalance. And that can actually cause a lot of problems. So there are specific types of herbs that can be helpful in balancing those out. There are other types of hormonal problems that can cause migraines. And even for men, there can be hormonal imbalances that can cause headaches and migraines as well. Another thing that I look for in terms of diet is looking at food additives, preservatives, dyes, artificial sweeteners, because those things are not natural. And the body can have a hard time breaking those down or being able to process them. And for some people, they have a sensitivity to those types of things being added in their foods. And in general, they aren't good for most of us, for really anyone to have in their diet. And so I will typically recommend taking a look at their foods, reading labels, trying to get food additives and dyes and preservatives and other types of things out of the diet because that can be very helpful. So also other types of things that we can look at, if there is a lot of stress, that can definitely be a contributing factor to headaches and to migraines. So I will often look to see, is someone having a lot of stress in their lives? What kind of techniques and things can we do to help them be able to manage their stress? And for many people, meditation can be very helpful. Meditation does not need to be sitting down in lotus position and oming for a whole hour. Meditation can be as simple as sitting and taking a few deep breaths. And there are many types of things that are helpful for meditation. One resource that I often recommend is the UCLA Meditation Research Center. They are a non-religious group that is associated with UCLA doing research into meditation. And if you go to their website, if you just Google UCLA Meditation Research Center, they have some free guided meditations that you can listen to on their website, and they vary anywhere from 3 minutes to 19 minutes. And personally, I will listen to them pretty frequently. I find that to be very helpful in having something very simple to listen to. I'll typically do deep breathing, and it takes you through some guided meditations to increase your awareness and your mindfulness. And that can be a very, very helpful stress reduction technique. There are many other types of resources for deep breathing. Things like yoga, that's more relaxing, can be very helpful for stress management. There's other types of things. So looking at stress management is also a really critical thing. I also look to see if mental health can be a factor. So if people have depression or anxiety, then that can be a contributing cause. If they have autoimmune conditions, those can be contributing causes to headaches or migraines. And I also look at something that's called methylation. Methylation is a biochemical process that happens in many different areas of the body. And it happens in the brain, in the liver, in the gut, and in other places. And it's very important to be able to have as a foundation to make sure that there are a lot of things that are going right in the body. So methylation is a foundation for things like liver detoxification. So our liver is our filter, and our liver has to break down and filter out toxins. This includes things like heavy metals like lead or mercury or arsenic. We also get exposed to many other types of toxins. Here in Hawaii, many of us are exposed to VOG, which is a combination of volcanic ash and smog. There are also frequently other types of pollutants, many different chemicals in our environment, and our body has to filter all of those. Our liver has to filter all of that and get it out of the body. Particularly if people are really sensitive to pharmaceutical medications or supplements, or if they tend to have a lot of heavy metals, then sometimes problem with methylation can be the underlying cause as to why their liver is not able to break those down and get it out of the body. And so that can be an underlying issue. If there are heavy metals, if there are other types of toxins in the body, those can certainly contribute to headaches and to migraines. And then if the liver isn't able to break those down and get it out of the body, then that will lead to an accumulation of those types of toxins that can build up in the body over time and contribute to problems. Another source of heavy metals that people often don't think of can be silver fillings or mercury amalgams. So the silver fillings or amalgam fillings have mercury in them. And most conventional dentists will say, oh, it's not a problem. You know, it's such a small amount of mercury that it's not going to cause problems. That being said, I've had many patients who have had amalgam or silver fillings where we've tested their mercury levels in the blood and in the urine, and we do find that majority of the time, the vast majority of those people that do have silver fillings do have elevated levels of mercury in their body. And so those mercury levels are caused by small amounts of mercury being released into the body and as people chew, and then it can build up over time. So if that is the case, I recommend that people have those mercury fillings removed. And it is really critical to have a dentist who is well trained in removing mercury fillings in the proper way, because if it's not removed properly, then that can actually cause a huge release of mercury into the body and cause even more problems. So I typically recommend dentists who have been trained in the proper way. There's a few dentists here locally in Honolulu that I recommend. I usually recommend Dr. Tony Kim or Anthony Kim. I also recommend Dr. Chad Kawashima, and there are other types of what are called biological or green dentists that you can look up in your area to be able to make sure that if you have mercury fillings that need to be removed, that they're removed in the proper way. So looking at methylation, again, because it's a foundation for proper liver detox, methylation also helps to regulate hormones. It is involved in neurotransmitter imbalances. So neurotransmitters are brain chemicals, and sometimes those can be contributing factors to headaches and to migraines. So I will look at that. So methylation is a very important process that needs to be happening correctly in order for you to have all of these other types of things that are going right. So this is just a sampling really of all the potential underlying causes of headaches and migraines. And it's really important to do a thorough medical history and a physical exam and to figure out what is the underlying cause. Testing is very helpful to figure out what can be going on with the patient. And I now want to just share with you a few cases of some patients that I've treated with migraines. And I will say the vast majority of patients that are treated with headaches and migraines have improved pretty dramatically over time. It is typically, if it's been going on for years, it's not something that is an overnight process. It does take time, and there is a timeline for healing. So it takes time based on the medical condition to be able to heal that and to get someone better. That being said, I have had a number of cases of patients who had debilitating migraines or headaches for decades, and they've tried all these different things. They haven't been able to get rid of them. And in working with me, that we have been able to significantly reduce the frequency and the severity of their migraines. And in many cases, usually over a period of a few years, we have been able to get those migraines completely resolved, where now someone who had migraines that was debilitating, that they had it several times a week or several times a month and they couldn't function, where they are now completely migraine or headache free. So that is possible, but you just have to know that based on the condition, it can take time. But that is time that's definitely well spent and well worth the effort, because if you can be able to get rid of those, then how much better is the quality of your life? So with some of the cases I had, this is one case I'd like to share with you. This is a woman that came to me in her 30s. She had had menstrual migraines or hormonal types of migraines. They would typically happen before her period would start. And she had been having migraines for many, many years. And she would also get depression. She'd have difficulty sleeping prior to her migraines. And so this was something that was really debilitating. And so what we did was we started with a very thorough medical history, looked at all of the different types of things that were going on with her. We did some testing to look at her hormones, and we did find that there was an imbalance in her hormones. I recommended some homeopathic remedies and also some Chinese herbs to help with balancing out her hormones. I also did acupuncture, and I also recommended some natural things to help to support her liver to be able to detoxify. The reason being is that I mentioned liver is our filter that has to break down toxins that we have in the body. The liver is also responsible for breaking down hormones. And very often, as I mentioned, when women have a lot of menstrual symptoms, they will be having migraines or other types of symptoms that is due to too much estrogen. And that can be due to the liver having problems being able to break down the estrogen and get it out of the body. And then as a result, they have this buildup of estrogen that occurs in the body, and then that leads to an imbalance in hormones. So we did some things to help with her liver detoxification. Previously, she had to take Excedrin every single day, and particularly around the time that she would have her period, she would be getting it pretty badly. So the migraines, they got to the point where they would cause nausea for her, but she had to go to work. And she also had difficulty sleeping. So as we started all these things, we started them one at a time. And as she started working with me, she noticed that her headaches started becoming less and less frequent. They started becoming less and less severe. And her insomnia improved, her mood improved. She didn't have the PMS, the severe PMS and the mood swings and everything prior to her period. We also later on did some food sensitivity testing, and based on that, I told her to stop eating gluten and dairy because she was having problems with her immune system attacking those foods. And so she reported that it was difficult at first, but as she got used to the diet, it started becoming easier and easier. And she also noticed that she didn't have as much bloating and stomach pain as she had before. And we also worked on her diet in terms of taking out junk food from her diet, foods with a lot of preservatives and sugary foods, things like that. And she also mentioned that she had anxiety as well. And I had recommended using lavender oil internally. There's some pretty interesting studies that have found that internal use of a high quality food grade lavender oil can actually be helpful in some cases of anxiety. And for her, that was very helpful. And so we went on continuous treatment, and it took, I think, about a year or two for us to get the migraines completely resolved, but then they completely went away, and she no longer has migraines anymore, and she's doing well. So that's one case. There's another case. This was a woman in her 40s, and she had non-hormonal migraines. So they were not related to her period, but she'd had debilitating migraines for many, many years. She had been on many different types of pharmaceutical migraine medications. She didn't like how they made her feel because she would be really groggy, really knocked out, but she had to take them in order just to not be curled up on her bed in debilitating pain. So that was that we started with her, and the course was pretty similar to the other patient that I mentioned. We did some food allergy and sensitivity testing, found that she did have some food sensitivities. We worked on improving her diet. We also worked on doing meditation. That was something that was really critical for her. We recommended some other types of things for her. I recommended CBD oil or cannabidiol oil, which was helpful in helping to decrease anxiety, which was a contributing factor to the migraines. Over time, we started with a number of other types of remedies to help with anxiety. I recommended homeopathic remedies, the herbs, acupuncture. She did find the acupuncture to be very helpful. And I also recommended fish oil, because when we tested levels of inflammation in our body, we did find that inflammation was high. And so the focus of our treatment was treating her anxiety and also decreasing inflammation in her body overall. And so as time went on, we found that the inflammatory marker did go down. It eventually did go to normal. And we also, one of the other things I implemented for her was an anti-inflammatory diet. So there are foods that can increase inflammation in the body, and there are also foods that can decrease inflammation. And the foods that increase inflammation, not surprisingly, are typically more processed foods, foods with a lot of sugar, foods that have a lot of additives or preservatives. Also, nightshades can sometimes be foods that can increase inflammation. So tomatoes, potatoes, eggplant, peppers are foods that are in the nightshade family. For some people, that can be a trigger to increasing inflammation, not with everyone, but with some people that can be a contributing factor. So for her, that was an aggravating factor. So we took out nightshades from her diet, took out processed foods, really put a focus on lots of vegetables in her diet, decreasing meat in her diet. She did still eat meat, but she was doing more vegetables. And her migraines gradually over time decreased in frequency and intensity. And I think for her, it took about 3 or 4 years until we were able to get them completely resolved. So it was a gradual process. And during those 3 or 4 years, she was seeing a continual improvement in her migraines and headaches. And it did decrease over time. But it did take us a while to completely get rid of her migraines. So it was after about 3 or 4 years that she was completely migraine free. And she is also still doing well. So as you can see, it takes a lot of time and persistence and effort, but it's definitely worth that time and effort and persistence. So if you have questions about your individual situation in terms of migraines or headaches, please feel free to give our office a call. We do offer a free 15-minute phone consult, and that is something that you can just call our office or email us to be able to schedule that free 15-minute phone consult with me. I'll be happy to talk with you in more detail about your specific situation and figure out a plan to be able to help you. So I look forward to talking with you. You can call our office. Our number is 783-0361. Again, 783-0361. You can also email us at sacredhealingarts@gmail.com. So it's sacredhealingarts@gmail.com. And you can find that information. We'll put it on this post. And the contact information for our office is also up at the top of the page. So I hope that this presentation was helpful for you. I hope that you learned something. And please feel free to share it if you found it helpful. Please like our page and feel free to share this video with friends and family or others that you feel might find it helpful. Aloha.